29th of January 2025. I can see that we have present councillors Allison, Anderson, Brogan, Brown, Councillor Archie Buchanan. I'm not seeing you present. Also present today is Councillor Matthew Buchanan. Councillor Callaghes? Yeah, I can see that you have joined. Also present today are Councillors Dewar, Devlin and Donnelly. Apologies from Councillor Fagan. I also have apologies from Councillor Falconer, but I can see that Councillor Cowie has joined as a substitute. I have apologies from Councillor Frame. Also present today are Councillors Handybode, Horn, Hose, Logan, MacDonald, McClymont, Nelson, Nugent, Ross, Scott, Walker. I have apologies from Councillor Watson, and I can see that Councillor Williams has joined also. We also have a number of officers present, and with that I'll pass back to yourself, Chair. Thank you.
Okay, thanks Elizabeth Ann. Just before I go on, people probably know Alan had taken a bit poorly yesterday. It's just to update people as far as we know. He's at home recovering, so we all wish him well. Suman, have you any further updates you want to?
Thank you, Chair. Good morning, members. So I would like to add my thanks to that expressed already by the Chair in terms of the work that our staff did right across the authority area on Friday, in very much the eye of the storm. As the Chair's highlighted, in terms of our social care and indeed our healthcare staff, they were incredible efforts, both in terms of those staff who had to be out because we are a Category 1 responder, we have a responsibility for public welfare, and we provide vital services. So, for example, there was over 2,500 home visits that were undertaken on Friday. That was providing essential care to people in their own homes, keeping them safe and reassured. Alongside the work within our residential services, be that for children, adults and older people, and a range of other areas. As Councillor Walker highlighted, there was some services we stood down, notably in terms of our day centres. Those have all been reinstituted as of the beginning of this week. We have had one or two buildings, most notably in Lesmahago, where there's been damage, as you would expect. We've moved the service users around so they can continue to get support through this time. And as the Chair's highlighted, our other colleagues within the Council are doing a huge amount of work in terms of the considerable repairs that need to be undertaken at the moment. I'd also want to just put on record my thanks to all of our staff involved in the logistics and coordination, and indeed who were providing services remotely through the course of last week. That's hugely appreciated again in terms of the consistency of service provision we provide. I'd like to express my thanks to Council colleagues from other resources for the huge amount of work that was undertaken, and as the Chair's highlighted, particularly our resilience team. The work of our partner agencies across our local resilience partnership, both in terms of the NHS but the other blue light services. And to echo the comment and support from the Chair, my thanks to our communities, both in terms of unpaid carers and families who took on additional responsibilities themselves that allowed us to focus on the most vulnerable last week, but also for the really warm thanks and support that they've fed back to our colleagues and services right across the authority over the last few days. Again, this has required a lot of patience. Friday was frankly unprecedented in terms of recent times, but there'll be learning that we can build upon. And as always, it shows the fact that our staff and our communities are willing to go the extra mile as and when we need them. Thank you.
Okay, thank you, Suman. I don't see any comments, so I'll just move on to the agenda now. I've got item 1 is declaration of interests. No. Item 2, minutes of the previous meeting, and that's pages 5 to 10. Are these approved as a correct record? Approved. Agreed. Thank you. Moving on to monitoring items. Item 3 is the Social Work Resources Revenue Budget Monitoring 2024 to 25, and that's pages 11 to 20. And could I ask Kathleen Gowrie to report on that? Thank you.
Thanks, Chair. The purpose of the report is to provide information on the actual expenditure against budget for the period the 1st of April to the 1st of November 24, and also to provide a forecast for the year to the 31st of March. The report reflects the expected outturn forecast on expenditure and income as at the 1st of November. At section 5.1, it notes that at the 1st of November, the resource projected outturn for the financial year is a break-even position. This is outlined in the service analysis statement at Appendix A on page 14. which highlights the key details by service for the resource. The position reported at period 8 across children and families, justice and performance and support is a break-even. The forecast underspends in justice and performance and support will facilitate a potential transfer to reserves for children and family services at the year end, and this will be confirmed as part of the probable outturn exercise. As a result of the transfer having been assumed in the reported position against children and family, it shows as an overspend. At section 5.3, it outlines that the resource is working towards managing the overall budget pressures on children and families in 24-25, and that will continue into 25-26. Appendices A to F on pages 14 to 19 provide details of the current projected outturn position with detailed variance explanations and proposed environments for each of the services shown on appendices C to F. If I refer members back to section 2 of the report, committee is asked to note the forecast to the 31st of March of a break-even and to approve the proposed budget environments. Thank you.
Thank you, Kathleen. Robert, Councillor Brown.
Yes, thank you very much for the report. Can I just ask about administration costs, which is the figure noted in the Adult and Older People Service at page 17, which shows an overspend of £211,000. Now, the explanation in note A doesn't seem to explain that. It talks about 0.07 administration costs as one of the recovery aspects. Can I have a bit of explanation as to what this administration cost is and why there's such a large overspend?
Yeah, Councillor Brown, this is in relation to replacement handsets for home carers. So they have obviously their mobile devices to record all their case notes and when they've arrived at the service user. So there's going to be a 3-year replacement programme for IT handsets. So we're going to have a kind of one-off cost in the current year. Those handsets have been confirmed they'll be replaced. There's over just 1,000 of them. They'll be replaced by before the end of March. So there'll be the cost of the handset plus the licence that would be required as well, so that in the event that the handset was lost, that we can kill all the data that's on the handset and it can't be accessed. So it's the security part of it. So it is a one-off, non-recurring cost that will happen this year and then in 3 years' time.
A silly question perhaps, was that not in the budget initially when it was made up last year, as it were?
So previously it would have been, we bought them when we put in the total mobile system, and that was purchased from Capital, and there'll have been a replacement programme for broken handsets and missing handsets. But now the council have moved to a policy whereby handsets have to be refreshed every 3 years. This is the first year that it will happen. So there is budget there, but what will happen in future years is we'll do a transfer to reserves at the end of the year so that we can draw it out, and every 3 years it'll be a funded programme. But just in year one, because it's the start of purchasing all the handsets, there'll be additional costs this year.
Okay, thank you.
Thank you. I don't see any more questions. People agree to recommendations in section 2? Agree. Thank you. Moving on to item 4, the Social Work Resources Capital Budget Monitoring 2024-25, pages 21 to 24, and could I ask Graham Booth to speak to the report. Thank you.
Thank you, Chair. Good morning, members. This is the standard capital budget monitoring report and the third for the financial year 24-25, and this reflects the budget, spend and outturn position to the 1st of November 2024, which is our accounting period 8. Section 3 gives the background to the report and explains the budget reflects the capital programme approved back in June last year, and there's been no change to this budget since the last report to this committee. At section 5.1, we're noting that the resources total programme for the year is 1.027 million. And as noted in section 5.2, Appendix A gives a full forecast spend for the year of 1.027 million against the 2 projects. And for information, also notes the actual spend incurred to the 1st of November of 456,000. I would refer committee back to the recommendation in section 2 of the report on page 21, and that the social work resources capital budget of 1.027 million and forecast spend of 1.027 million be noted. Thank you.
Thanks, Graham. I don't see any questions, comments. Do people agree to the recommendations in section 2 of the report? Agreed. Thank you. Moving on, item 5, Social Work Resources Workforce Monitoring, October and November 2024, pages 25 to 32. And could I ask Eileen McPake to speak to the report? Thank you.
Thank you. Good morning, everyone. So this is the standard workforce monitoring report for the resource covering the period October-November 2024. So section 4.1 outlines the attendance statistics and the details are in Appendix 1. The absence rate for the resource for November is 8.7% compared to a council-wide figure of 6.9%. And this is increased by 0.1 compared to the previous month, and compared to last year the figure has increased by 0.9%. That translates to a projected annual average for the resource of 8% compared to a council-wide figure of 5.7%. So members will be aware that resource managers continue to follow the maximising attendance procedures and work with personnel colleagues to ensure that all the supports are in place to enable employees to return to work and appropriate actions are taken. And you'll also be aware that at the last committee meeting, members noted the high absence statistics for the resource and were advised that a further report on how absences are managed within the resource would come back to the committee. This will now be presented when there's an internal review of our maximising attendance arrangements that is not yet concluded, and once that has been finalised, we will bring something back to this committee in terms of how social work resources are managed in their absence, and also an update on any of the internal revisions that are the recommendations that are coming out of that. Section 4.2 to 4.5, the details are in Appendix 2, and the main points are that during the period there were 341 occupational health referrals, there was 6 disciplinary hearings, there was 2 grievances and 2 dignity at work issues that were raised. There was the 8 accidents or incidents that were recorded during the period, and there was 18 leavers during the period, and of them 44% completed exit interviews. So I'll refer committee back to section 2 and ask that the workforce monitoring information for social work resources covering the period October-November 2024 be noted. Thank you.
Thanks, Eileen. I don't see any questions. Sorry, Councillor Hose.
I was on, sorry. Forgive me if this has been asked before, but on Appendix 2, Employee Counselling Service, it's gone from 9 last year to 79. So I just wanted to know a bit of extra information on that. If you could, thank you.
That's fine. I can get the detail around that. I don't have the background information.
It's just quite a leap.
And yeah, I appreciate that. Sometimes it might well be that it's just in terms of the period in which it's recording, but I will have a look at that, and I can give an explanation to that at a later date.
Thank you very much.
Thank you. Don't see any other questions. Do we agree to the recommendations in section 2 of the report? Agreed. Agreed, thank you. Moving on, item 6 is the Social Work Resource Plan Quarter 2 Progress Report 24 to 25, and that's pages 33 to 54. And can I ask Craig to speak to the report? Thank you.
Good morning, committee. So you'll see from the progress report that we have highlighted in 5.2 the position against each of the 54 measures and progress against those. 5.3 we've highlighted a range of the key achievements in the reporting period, whilst 5.4 highlights those areas for improvement and some of the supporting narrative around action which has been taken. And beyond that then, I would take you back to the recommendations in paragraph 2, and happy to take any questions.
Thank you, Craig. I don't see any questions for Craig. Okay, do we agree? 2?
Agreed.
Okay, thank you. Moving on to item 7, Social Work Resources Risk Register, pages 55 to 62. Can I ask Craig again to speak to the report? Thank you.
Yeah, thank you, Chair. So you'll see we have set out the background in section 3 to the report, which provides the overall position in terms of how this report fits in with the other risks in the wider council services. Beyond that, then, we have highlighted at 4.2 the 4 very high risks that are currently on the register, and in particular, you will note that we have escalated the score associated with winter pressures from 16 to 20, and that obviously takes account of the position as it moved throughout the reporting period. At Appendix 2, we have highlighted the other risks which are regularly reviewed and actions taken to mitigate these risks as well. And then beyond that, I would take you back to the recommendations in Section 2, and again, happy to take any questions.
Thanks, Craig. I don't see any questions. Do we agree to recommendations in Section 2?
Agreed.
Agreed, thank you. Moving on to items for decision. Item 8, consultation on the future of foster care response, pages 63 to 72. And could I ask Liam to speak to the report? Thank you.
Thank you very much, Chair, and good morning, Committee. The purpose of this report is to update the Committee on the future of the foster care consultation and the response from South Lanarkshire Council. In relation to Section 3, it sets out the background of the report, and you'll see within that this is on the back of an independent care review, and it's a commitment to the promise going forward. At 3.3, you'll recognise that it's been there's a reduction in foster care across Scotland, and this is one of the challenges we have, hence one of the reasons for the inspection or for the consultation. The consultation was opened up in October 2024 with the deadline for the 6th of February. You'll see Section 3 as well also highlights that there are 12 questions with regards to the consultation, and the response from the Council is attached to Appendix 1. Section 4 gives a summary of the consultation proposals, and just to highlight the aim, it's about the vision, it's about the flexibility of the fostering approach going forward, it's looking at the recruitment of foster carers and the retention, and it's also looking at how we recognise the status and the value of foster carers going forward. As said, the Council's response is attached to Appendix 1. This was in consultation with officers, with Family Connections team and with carers themselves. Elected members should be aware that they can actually fill in the consultation themselves independently. However, in relation to the response, what we're looking at is for the committee to note the report and that the appended response at Appendix 1 be approved for the deadline to be submitted for the 6th of February. And happy to take any questions, Chair.
Thank you, Liam. Councillor Allison.
Thanks, Chair. Liam, 600 families less willing to take foster children over the period. Has any work been done to identify why foster carers are withdrawing from the scheme? Is there such a thing as a leavers interview so that we could perhaps address the issues that the people who are leaving the service?
Thank you, Councillor Allison. I'm not aware of there being any research specific about why carers are leaving. What I know from our own experience within South Lanarkshire, carers leave because it's a natural time for them to leave. It's like a retirement type plan or a natural exit strategy. What we've also got within those 600, almost 600 that have left as well in terms of foster care, a number of them will actually have gone on to be adoptive carers as well. So they've actually then fulfilled their requirements and they're actually taking children for the rest of their life. So it's not all negative outcomes for that. What we're aware of as well is actually the challenge for foster carers in terms of the complexity. It is very complex, it's intense work. And the reason for this consultation is we're trying to raise the status of foster carers and actually look at how we can look at a national recognised rate for them as well. There's quite a disparity between internal and external payments for foster carers. So, for example, an external foster placement, we would pay 2/3 more than what we currently pay for our internal foster carers, but that doesn't convert to actually the rate for the foster carer. Most of that is about management costs and finding costs. So this consultation hopefully should give us a level playing field, or then at least address the areas we need to look at nationally, and we'll look at them locally as well. But in answer to the first point, there's no research I'm aware of that looks at why we've got 600 that have left the profession or left that discipline in the past 5 years.
Okay, thank you, Liam. I don't see any more questions or comments. I just say thank you for the report. A lot of positive suggestions and a lot of positive changes, I think, in terms of the legislation. So, no more questions. Do we agree to the recommendations in section 2?
Agreed.
Thank you. Moving on. Items for noting. Number 9, sustaining social work, children and family services budget recovery update, and that's pages 73 to 78. And can I ask Liam again to speak to the report? Thank you.
Yeah, thank you, Chair. Committee, this is the regular report that has came to every committee since March 2024, and it's looking at the budget recovery options due to the challenges around children and families budget. In relation to this report, Section 5 just sets out the background which you are familiar with. Section 4, in terms of the updates, is there's 3 areas we're looking to update the committee today. One's about the commission of the new intensive family support service. Second is about the transition to independent living programme, and that's at Section 6. And the third is about the review of the emergency social work. Section 5 gives a background to the intensive family support service, and what you'll see within that report is that the contract has now been awarded, and Action for Children were the successful bidders for that. They've got a 3-month implementation, and that should be fully up and running by April 2025, and that will then look at high-cost placements returning, but also a reduction in those that are going into high-cost placements. In relation to Section 6, the transition to independent living, that commenced last year in November 2024, and what you'll see within that is that we've realised initial savings of 230 million for 2024-25, and we're looking at a recurrent saving of 0.8 million going forward with that. So we've seen initial successes of the Bernardos project, and that's joint with our colleagues in housing. Section 7, we highlighted that we would bring a report about the emergency social work services review for this committee. We've had to defer that, and we will bring that to the March committee in 2025. In relation to the financial implications, there's quite extensive information about the financial implications within the report. You'll see at section 8.1 that the non-recurring 7.7 million reserves is actually looking to address the 10.6 million for 2024-25. However, that will not be a solution going forward. Further financial implications are highlighted at section 8 within the report, and if there's any clarification needed from that, we've got Kathleen Gowrie from Finance who can clarify the calculations there. There are no employee implications in relation to this report. However, there will be for the emergency social work, and we'll bring that to the next committee. In relation to the implications, it's important to highlight that one of the biggest challenges for children and family services is the budget pressures, and that's highlighted within the risk register is very high. Workforce availability and capacity is also very high. However, public protection and legislative duties are at a high now. That is reduced from the last committee as well. So if I can refer members back to the recommendations, what we're asking is the contents of the report be noted, and at the update and then the commissioning of the intensive family support services be noted, and the transition to the independent living programme be noted. Thank you, Chair.
Thanks, Liam. Don't see any questions. Okay, do we agree to recommendation 2 in the report?
Agreed.
Agreed, thank you. Moving on to item 10, it's the Winter Plan 2024-25, and that's pages 79 to 120. And we've got Craig to speak to the report, and also I believe we've got Colin Lauder, the Deputy Chief Exec, NHS Lanarkshire, is going to be speaking as well. So just ask Craig to come in. Thank you.
Thank you, Chair. So you'll recognise that the winter plan has been prepared for some time, but it's just the timing of the way the committees operate that this was the time it's coming to this particular committee. It has, however, been well trailed through the IGB, Health Board and a range of other committees as well. The report highlights the multi-agency approach, both in terms of the preparation of the report and also, as has been demonstrated across the winter, and in particular last Friday, it is very much multidisciplinary and multi-agency in its execution. You'll see that in the early bit of the report, I highlighted the unpredictability of a range of issues that often occur during winter, and that has been borne out this year through the very high prevalence rate of RSV, flu and other viral illnesses, and indeed the weather we had on Friday past, which was the highest wind speed we'd had in the last 10 years. So that is also one of the features of the winter plan, that it requires to be dynamic and we require to respond to different things as they emerge. In terms of the prevalence of flu and RSV in this particular year, that doesn't just impact on the number and severity of inpatients across the hospital sites, it also impacts on our staff, and we saw significant peaks in the numbers of staff absence as a result of that respiratory illness. And again, that wasn't just within the directly employed staff of the council and the health board, it was also those staff with other providers across the range of services that make up the totality of health and social care in South Lanarkshire. The 3.6 in the report highlights the work that was undertaken as part of Operation Flow. And whilst much of that relates to work which is undertaken within the 3 acute hospital sites, again, as a partnership, South Lanarkshire Health and Social Care Partnership and indeed our colleagues in North play a huge part in the whole Operation Flow and management of unscheduled care. And that goes right through from helping to avoid unnecessary hospital admissions to trying to support people's discharge as early as possible in their care journey as we can safely manage. And I'm sure Colin will touch a wee bit on that just at the end. Beyond that, a couple of other things I would probably want to highlight to you. NHS Lanarkshire is the only board in Scotland that has got an arrangement whereby we have got GPs who are prepared to open the practice on both public holidays and the Saturdays through January. And this last 2 weeks, we've had something like 65% of all our practices open on the Saturdays. Again, that helps improve access to the GPs themselves, but it also helps take demand away from out-of-hours services and indeed accident emergency departments, again, bearing out that bit about multi-agency and full system working. One of the other things that is of particular note this year is our vaccination programme. We, like most of Scotland, have seen a dip in the vaccination uptake rates, and one of the things we'll be doing as part of our debrief is trying to understand if there are any specific reasons for that, specific to Lanarkshire, and also areas we might look to try and do to improve uptake of staff vaccination. As I said, very similar to the rest of the country, but nonetheless a hugely important tool to try and make sure we're mitigating the impact of winter. We will also, again this year, undertake a full debrief. Our debrief is scheduled for the 6th of March, and in turn we will turn that into learning and papers that will feature as part of the winter plan for 2025-26. So that would be the main areas I would want to highlight in the report. However, as the Chair highlighted, Colin Lauder, Deputy Chief Exec from NHS Lanarkshire, has also joined us. And Colin, I would ask if there's any other comments you would want to add to the update I've provided. Thank you.
Thank you, Craig, and thank you, Chair. Could I just check my audio is working?
Yep.
Thank you. It's very opportune for me to be able to attend the committee today, and my thanks very much for that. As Craig has touched on, we are part of an ongoing process called Operation Flow. Just in terms of who I am, the badge of Deputy Chief Executive means I'm responsible for the direction of our unscheduled care programme in NHS Lanarkshire. And I also have the added honour as of Saturday morning of becoming interim Chief Executive for a limited period of NHS Lanarkshire. So I'm very much looking to learn from our experience, not only over the last winter, but also over the last 2 years as we take the unscheduled care programme forward. The Operation Flow was established in March 2023, and it's very much about learning. We have various plans in place covering the whole patient journey from first education through to and we continue to develop those plans. I spoke to colleagues in North Lanarkshire last week and had an opportunity to speak to elected members and also members of the IGB with regard to the experience of the winter in particular. And as Craig had said, that will feed very much into our plans going forward. And I'm here partly in listening mode as well to hear any comments or views from members of the committee with regard to how we can strengthen our plans for 2025. In terms of a bit of context, I'm sorry, I'm getting an awful lot of feedback on my line. I'll persevere. In terms of context, the ageing population, I think, is the largest presenting issue with regard to unscheduled care. And since we began Operation Flow in March 2023, we will have something of the order of 4,000 additional citizens alive who are aged over 75. And that obviously presents a health need, which we must meet both as a health board and also as an IGB. Flu has been difficult this winter, as Craig has alluded to. The word which was used by Public Health Scotland was extraordinary. It doesn't mean it was unprecedented. It means that it peaked time.
We're kind of losing you a bit, Colin. You're fading out. Is your mic
Yes.
on?
I'm getting an awful lot of buzzy feedback on my line.
That's better now.
Okay, that might help. I'll move my face closer to the screen if you can bear that. In terms of flu, just to give the colleagues some numbers, just after Christmas, we had 147 people in our acute hospitals with flu. That was the peak. And to give that again some context, these are the numbers of infectious diseases that we saw during 2020 with COVID. So clearly that was a difficult position to manage. We also, I have to say, had a significant number of delayed discharges in hospital. And for South Lanarkshire, that number peaked at over 120. I'm happy to say, obviously that was a direct consequence of sickness within the social care workforce, which was replicated right across Scotland. And I'm happy to note that the number is now well below 80 in terms of people in hospital today. In terms of what we do about all of this, the paper refers to Flow Navigation Centre Plus. And again, I think it'd be worthwhile to give colleagues a wee bit of a briefing as to how that is able to present a solution to some of our unscheduled care challenges. Today, there are 102 people in virtual beds across Lanarkshire, and that number will grow to 400 over the course of this year. Having those beds, these virtual beds in the community has been a massive enabler in terms of us able to manage the pressures over the Christmas, New Year period in particular. And we're receiving something like 200 attendances through the Flow Navigation Centre each day. And these are coming from care homes, from general practitioners, from the Scottish Ambulance Service and from the police. All of these attendances are new pathways which we've developed within the last few months and which allow people to be cared for at the right time, in the right place, without necessarily having to attend an ED. So these are avoidance of presentations at ED, which has allowed us to cope not well, but better, I suppose, than we would have done otherwise. If you look across Scotland, you'll have seen in press reports and from other sources the impact of the winter in Aberdeen, Glasgow, Forth Valley and Edinburgh. We in Lanarkshire have not seen those extremes, but we've had obviously had quite a number of difficult days where patients have waited too long and have received adverse care as a result of that. But nevertheless, we're on that journey. So with that as a context, with the assurance from the Health Board that we continue to work whole system with both IGBs, with partner agencies, and taking the learning from a recent experience, including the winter plan forward, I'd be keen to hear views of anyone from the committee with regard to that work as it continues. Thank you, Chair.
Thank you, Colin, and thank you for coming to the meeting and contributing. And it's very valuable to have your perspective. Councillor Brown.
Yes, thanks very much, Chair. I think it's a very, very useful report. One of the things that I think has been an impressive success in recent years has been the vaccine programme. And it was, I think, worrying to hear that the take-up had sort of dipped. I wonder if I could ask really two questions on that. Firstly, with regard to staff, both in the care service and the NHS service, is there any issue with regard to full take-up by staff of flu vaccine things? Is there anything surrounding that that can be done? That's obviously a target group, if you like, that you've got a little bit of employability control over, so to speak, and it's very useful if you can actually get that. Secondly, is there any linkage between the staff absences and those who are not being vaccinated that people are aware of? And similarly, with regard to the 147 people with flu in hospital, have we any idea if these were people who are not themselves vaccinated? Because I think the linkage between the two, I think, is actually quite important. The big success of the flu vaccine programme and the other vaccines that go with it, I think I've been jabbed for pretty much everything in sight over the last period. And it's welcome, because it certainly, in my instance, has kept me, I think, healthy. And hopefully that's the case with many other people as well. I wonder if I can have a bit of comment on those observations, if I might. Thank you.
Do you want to respond to that, Colin?
Yes, thank you, Councillor Brown. Yes, it's worrisome that the vaccination levels for flu within both the general community and also within health and social care staff have dropped off from the levels we've seen in previous years. There is, I'm sure, a lengthy discourse with regard to the reasons behind that, but it's certainly, I can say, it's had an impact. It's an impact within the community because people have unfortunately died in our hospitals over the last few weeks due to flu. And it's also, as you've pointed out, Councillor, affected our ability to staff our wards and our clinics, etc. And obviously a similar impact with regard to social care staff. I think we need to acknowledge that we, as a whole system, need to do better because the flu vaccination is effective. It prevents illness and it prevents mortality. And we have failed to convince our citizens that that is indeed the case in sufficient numbers for more than 30% to attend for vaccination when they're eligible. And that applies to our staff as well. So I really do see that as one of our major challenges. And I will be, in conjunction with colleagues, undertaking a full review of that failure to achieve the vaccination levels necessary. I won't postulate any off-the-cuff solutions as we sit here today, but take it some assurance that, in fact, that will be one of our key areas of endeavour moving into the next few weeks.
Thank you. I was just saying, I mean, in relation to the delayed discharge, I mean, South Lanarkshire is not an outlier by any manner of means in terms of the benchmarking across Scotland, and there's been significant reductions in delayed discharges. If you look at the discharge pathways in relation to, care at home and people being assessed at home, and different pathways in relation to people who have more complex care, and you have to go home with care packages, and sometimes there still are delays in the system for probably some of the reasons that Colin was outlining. But it would just be useful maybe to ask you, Colin, what's your view in terms of some of the delays that there are and people waiting in care packages in hospital who are not able just to go home and be assessed at home and get care delivered at home at as early a stage as possible. And also one of the key things is planning for early, as soon as someone is admitted, to start planning for discharge, which is good and sounds good in principle and would probably make quite a significant impact, but that doesn't always work. So it would be quite useful for me to get your views, Colin, on what the kind of barriers are there to having the flow going as smoothly as it can in every case. Does that relate back to what you were saying in terms of staff sickness and maybe pressures in acute wards, because sometimes the flow doesn't go that smoothly. So it'd be useful to get your view on that, Colin. Thanks.
Thank you, Chair. I think I need to say first up that unfortunately in the public discourse it's often a case that the IGBs are put in the frame for delayed discharges. That's absolutely not the case. If you look at the reasons why someone is discharged from hospital, there are multitude of reasons. I have a spreadsheet here from this morning for South Lanarkshire citizens who are in the various hospitals, and I think the list of reasons runs to about 20. And the acute colleagues, the clinical colleagues in hospital, have a significant bearing on some of those delays. So therefore, we need a partnership. We have a partnership, in fact, let me rephrase, focused on delayed discharges. We'll never bring the number down to zero because there will always be people who are waiting for EWIs or have mental health issues who require those to be unpicked before they can actually be cared for properly. But for those that we can influence, a lot of it is about process. And part of Operation Flow, working with the IGBs North and South, is about making sure that process and those human factors of decision-making within a ward, communication between different teams are addressed. Again, it will be one of my, continues to be one of my key areas of focus. And again, we've learned quite a lot since the last autumn, particularly in South Lanarkshire, where we saw the numbers drop through October into November quite considerably. Again, impacted primarily due to staff sickness over the Christmas period. Again, these numbers have dropped again. And South Lanarkshire does sit reasonably well with regard to the Scottish average. And the Chief Executive and myself are jointly committed to making sure that that number gets as low as possible. We could talk about the individual reasons for that, but if you're sufficient for me to give you that commitment and also to recognise that this is very much a team game and not finger pointing at South Lanarkshire colleagues. Thank you.
Okay, thanks, Colin. Councillor Allison?
I think we can all understand the problems we've got with delayed discharge, etc. But there is a feeling that that has been ongoing for some time and not simply a result of winter pressures. We're all aware of various people who have been up to 50 hours either lying on a floor or a trolley in A&E. So first of all, can you maybe give us an insight into how they're being looked after? Do they have shower facilities? What type of corridor care do you have? Also, can you tie in the RCN report that came out the other week and how they were highlighting the different problems here and the effect it was having on staff? And are we doing anything to try and alleviate these pressures?
Thank you. I'll just come in on that. Thank you, Councillor. So corridor care is not a term we recognise in Lanarkshire. We have had days in which people have been waiting excessive periods of time, and that's well documented, and colleagues are aware of individual episodes of that happening. That is an extreme, and it's something that we very much will avoid at every opportunity. Where patients, where overcrowding does happen, particularly in the emergency department, we do put on additional staff. We do make sure that these patients are monitored clinically and also emotionally in terms of the impact that's having on them, and we do seek to move them on as quickly as possible. We have seen queues with regard to ambulance patients waiting to come into hospital, and we've adapted our systems and our spaces to make sure that patients are brought out of ambulances where they can't be immediately triaged and brought into the hospital. Where beds aren't available, clearly that's a flow issue, which is the whole endeavour with regard to Operation Flow. But we have conducted an audit over the past fortnight with regard to where those delays have happened, an audit of the care that's been given and the patient experience, and that will form part of our learning as part of our plans going forward. I'd like to apologise for to those patients who have experienced that poor standard of care. It has been exceptional. It's not our norm, and it's not something we in any way will build into our pattern of clinical delivery moving forward. Thank you.
Okay, thanks, Colin. Councillor Brown.
Yes, I'm very sorry to come back in on the issue of vaccine, but I'm not entirely sure I got a full answer to some of the points I asked for before. I appreciate there's a review being done. I would ask, if I may, that amongst other things, we get a report back to this committee at an appropriate time during the summer period, presumably, about the outcomes of that and some of the implications of it. I was slightly staggered by the 30% take-up figure, I must confess. I thought it was higher than that, and I think it's a bit alarming that that's the level of take-up amongst the population that we actually get to. But I had asked specifically about the question of whether there were linkages between those who ended up in hospital and other sorts of situations like that, or staff members who are off, and whether they've been vaccinated or not. Because it did seem to me there were hits to be had there quite quickly that would make a big difference to the potential there. I appreciate the vaccine doesn't stop you getting the flu, but it does actually very much minimise the implications of it, and hopefully would have considerable effects on both hospital admissions and staff availability if that was got right. I wonder if we can have a bit more information on that particular matter. And I think the actual 30% thing, if I may say so, does require a bit of crisis attention, because that's actually quite a low figure against the potential advantages of the flu programme, in which a lot of investment has taken place, quite rightly, which I think in other regards has been a big success.
Okay, thanks, Robert. Craig.
So, right, that's us now. Thank you. So, 2 or 3 things. Firstly, I think the 30% Colin reference was the 30% who didn't take a vaccine. So the figures were nearer 70% uptake. And again, we have got a classification across different categories. So we will be able to, as part of our winter debrief, highlight exactly what was the uptake in those in care homes, the over 75s, the people aged between 18 and 65 with underlying health conditions, the people under 18, so children with underlying health conditions. We're able to break that down per category. We're also able to go further using public health data and get information around uptake rates across like BME communities, travelling communities and so on, such that when we move our vaccination programme forwards, we can put in specific bits of work to try and reach people who might otherwise have difficulty getting the vaccination. Just for some reassurance, this last year, we recognised that for some of the over 75s, they were telling us that they were finding it difficult to travel to the mass vaccination centres, for want of a better description, albeit we don't have the same capacity of mass vaccination as we did in the past, as rightly some of those properties have been returned to their original purpose. What we did was we undertook an exercise with our local pharmacists, whereby all our over 75, well, a large majority of our over 75s were offered an appointment at their local pharmacist, as opposed to going to their vaccination centre, recognising that for the vast bulk of people, a local pharmacy would be easier to access than a centre. For those people who didn't access a centre, we then called them, whether that was a pharmacy or the centre, we called them back to ask, we're conscious you didn't attend the vaccine, would you like to attend? And at that point, we were then seeing a much higher percentage of people saying, I'm fed up being vaccinated, I've been vaccinated multiple times in the last 2 years, if I've not got COVID now, I'm never going to get it, and all the other things that people were coming out with that demonstrated this national phenomenon that's been seen around vaccination fatigue. Specifically around our staff, we've already commissioned a bit of a deep dive. There's a group that I'm chairing that includes our Quality Directorate, Public Health, HR through our SALIS group. And again, that's looking at the uptake around staff and again, any particular lessons. We did, in fact, have a survey that was done last year by Public Health Scotland, and staff from NHS Lanarkshire and council staff were proportionately much higher respondents to that. So we used that information to help shape the programme we delivered this year, but nonetheless we still did not get an uptake level that we would have wanted. So that's why we've committed to this deep dive to see what else might we do for the planning for 25-26, and that will feature as part of the overall debrief that we take forward. So there's a huge amount of work being done in vaccinations nationally and locally, and despite some of our best efforts, including things through newsletters, we had interviews with pictures of the medical director getting vaccinated. We've had interviews with the director of nursing telling people the importance of getting vaccinated, but we're still seeing this tail off. And just because I've got so many of you here captive, I would want just to reiterate, flu kills. Getting your flu vaccination is very, very important. As Colin said, we had a number of people who lost their lives due to flu. I personally had a friend who was in his early 50s, that died of flu a few years back. So it's really important you get your flu vaccination. And for those people who are vaccinated, even if they get the flu, we know that in most cases the impact will be significantly less than it would be for those who weren't vaccinated. So there is a direct correlation between the impact and severity of the infection and whether you've been vaccinated. The other thing is that the flu variant changes every year. So the more often you get your flu vaccine, the more likelihood it will be that you will have some resistance from previous vaccines, depending on the vaccine strain that comes along the next year. So I would very much urge everybody to get their flu vaccine who's eligible to get it. But there's a huge amount of work being done, and that will feature as a big bit of our learning for next year.
Thanks, Craig. Kirsty?
Thanks, Craig. Just piggybacking on that question there. I'm just wondering, really interesting to hear that you're talking about a deep dive into the reasons, presumably why our own staff don't, what they take up is very poor. Does that include, for example, maybe looking at mechanisms to challenge misinformation about vaccines, which anecdotally, I think all of us will probably have experienced that from our friends and colleagues. Thanks.
Yes is the short answer, and as I'd mentioned, we tried 2 or 3 different mechanisms this year beyond the national campaigns, and one of the things that we touched on when we met about the deep dive thing was whether we could get some traction nationally to put information out there around the impact of flu and to try and challenge some of the misinformation that goes out. The other thing that we're very conscious of is that there was an article in the BBC just a few weeks ago as part of the impact of COVID vaccination, and it shows you 1 or 2 individuals who were very significantly impacted, but it doesn't then talk about the 5 million people who were vaccinated and didn't end up with an illness as a result of that. So there's something about how we try and get the comms right. And as I said, we're trying to raise that nationally as well as locally. The other thing we are talking about is whether there's something more significant and different, manipulative, whatever we can do to try and push information out on social feeds. Because what we have been seeing, and again, much of this is anecdotal, but folk will bring in pictures of somebody that's put something on a local community chat group or Facebook group about, oh, look at what happened to me, or I ended up off my work for a fortnight, and all of a sudden you've got a whole trail of folks saying, oh, well, I'm not going for it in case I'm off my work for a fortnight. So it's trying to get in front of that misinformation is really important.
Thank you. Councillor Allison.
Apologies for coming back in, Chair. It was just on the follow-up from what Robert was saying. Firstly, a lot of the changes in the last year were taking it away from doctor's surgery. Are you considering not going back to doctors administrating the vaccine? They seem to have been more successful in getting people to come forward. Secondly, with the low uptake at this time, when does the programme finish for this winter, if you like? Is there any point in extending that and trying to address the issues that have been caused?
So, a couple of things. In terms of the vaccination programme getting taken away from the GPs, that was part of a national contract. So, again, that was a national position. And what we then looked to do was to provide alternative routes for that. COVID came along around the same time, and so we kind of piggybacked COVID and flu together, and they're now co-administered vaccinations. So if you're eligible for COVID and flu, you get both vaccinations when you turn up there. Now, we did absolutely recognise that some of the feedback we were getting was it was better when we could get it at the local health centre. So this last year's campaign, as well as the local pharmacies for the over 75s I touched on, we also provided a number of pop-up clinics in health centres across Lanarkshire and outpatient departments at hospitals at weekends, evening sessions in our local health centres as well. So we have really expanded the range of different premises that people could access a vaccine, again trying to support that greater uptake. In terms of the length of the programme, the programme actually finishes on the 31st of January, and what we are seeing now is the law of diminishing returns. So we have really pushed hard. We have contacted people who have not been vaccinated. We have put on those local clinics. We have put the local ambulance bus into particularly rural bits in Clydesdale. And beyond that, then, having asked and provided additional clinics, we are seeing very, very little uptake now. So, I think pretty much MD who was going to be vaccinated has been vaccinated. And I think really now we need to be pushing our efforts to what we need to do for next year's campaign.
Okay, thanks, Greg. Suman, you...
Thank you. First of all, I'd like to express my thanks to councillors and committee members for their interest in terms of vaccination as a key public health programme for us. As a number of you have alluded to, misinformation within the space is a real problem, not just nationally, but globally. And so actually the ability for elected members to send a strong message out to communities about the efficacy, the importance of getting vaccination is really, really important and very much appreciated. It is just to kind of highlight the points made by Colin earlier. So firstly, we are frustrated, shall we say, in terms of the position we found ourselves in, not just within Lanarkshire, but actually across Scotland in terms of the impact the flu's had across our communities, across our services, and also the extent to which the vaccination uptake levels have not been at the levels that any of us would have wanted. As Colin says, we don't speculate in respect to that. As I said, there's quite a lot of misinformation, so for us, the importance of doing deep dive work, both within the Lanarkshire area as well as at the national level, is really important. We are clear, though, that if we need to make change to how we deliver our programmes, we will do that, because for all the work that Craig has set out, we've not had the impact that we would anticipated. Also, though, as some of your questions have alluded to, a lot of this is about how we as citizens engage, how we support and provide information and encouragement to our neighbours, our families, in respect of that. So there's a wider discussion to be had around these kind of public health measures and how they can be broadly supported across all of our communities. That's not going to be an easy conversation, but I suspect it's one we need to have. This is an item obviously predominantly for the NHS board rather than council, but given the interest of members, when we report back to the health board, I will of course share the report with members directly rather than through committee. And in terms of the specific issues around the uptake of vaccination by employees of the council, we will build that into the workforce monitoring reports going forward, so you can see the specific work that we're going to do within that space, again, to make sure that these are as accessible as possible, plus providing them with our colleagues with all the information they need in order to make informed choices. Thank you very much, Chair.
Thank you, Suman. I don't have any more questions. Colin, would you like to come back in any points?
Thank you, Chair, and thank you to Craig and Suman for the supplementary information on vaccination. We need to be clear that 30% was indeed the number who didn't take it up. And clearly, just to finally answer the question, it does, of course, have an impact on our ability to function as a health and social care system. And it's in everyone's interest to increase that rate for the next season. Thank you very much for your time today.
Okay, thank you, Colin. I don't see any more questions. Could I first of all just thank Craig for the report, and also thank you to Colin. That's been really useful and valuable. I mean, obviously through the integrated joint board we have the NHS perspective and NHS Lanarkshire, but it's also useful to have someone like yourself actually make a contribution to this committee, because obviously delayed discharge, all of it is impacted across a whole range of different functions, and sometimes it's hard bringing the whole landscape together. So thank you for that, and thank you for your contribution to the committee, and thanks to Craig for the report. Do we agree to recommendation 2 in the report? Agreed. Thank you. Moving on to item 11, Prisoners Early Release Scotland Bill 2024. Implications for South Lanarkshire Community Justice Partners, and that's pages 121 to 126, and could I ask Gillian to speak to the report. Thank you.
Good morning. Thank you, Chair and committee members. The purpose of the report is to provide an update on the implications for South Lanarkshire Community Justice Partners on the implementation of the Prisoners Early Release Scotland Bill 2024. Section 3 explains that on the 18th of November 2024, the Cabinet Secretary for Justice and Home Affairs introduced the Prisoners Early Release Bill to the Scottish Parliament. Sections 1 and 2 of the bill propose that most prisoners serving a sentence of less than 4 years were to be released after serving 40% of their service, rather than the 50% as currently is at present. This change would not apply to prisoners who are serving a sentence for a current sexual, domestic abuse and domestic abuse aggravated or terrorism offences. Those with historical sexual and domestic abuse offences, those previously serving custodial or community sentences for those offences would be eligible for these release arrangements. Appendix 1 demonstrate illustrations of sentence lengths when 40% is applied. The bill requires royal assent on the 31st of January this year to become an act, with intended changes to come into effect on the 18th of February this year. It has been estimated that between 260 and 290 people will be released nationally. Section 3.10 highlights the 3 tranches of release starting on the 18th of February, the 4th of March and the 18th of March. Since writing this report, it should be noted that these arrangements will take place, as I say, on the 18th of March. Since writing this report, we've had all 3 tranches numbers for South Lanarkshire provided to us. And we expect to have some more numbers provided to us for those that have been admitted to custody since the implementation of this Act at the end of the month. Thereafter, the 18th of March, 40% releases will take place through routine release management. It should be noted that these release arrangements are separate from the Emergency Early Release Act provisions that took place in the summer of 2024 as a mechanism for managing population pressures over a contained period of time. Section 4 outlines implications for South Lanarkshire Community Justice Partners, with impact most notably levelled towards housing services and our alcohol and drug services, both statutory and voluntary. Section 4.6 states housing services approach to providing temporary accommodation to minimise the negative impact of homelessness on release from prison. These will bear an additional cost, and Section 6.2 notes a commitment from the Scottish Government of £1.3 million nationally to support housing authorities. Section 4.8 outlines that community justice partners are organising a series of communication and information sessions in January for partner organisations to ensure that all agencies understand the initial release arrangements. The South Lanarkshire Community Justice Partners will also act to monitor arrangements and share developments as they occur with the Scottish Prison Service. An initial operational action plan has been prepared and will be updated on an ongoing basis for relevant community justice partners to ensure that communication and preparations are in place. I conclude this report today by asking the committee to approve the following recommendations and note the contents of this report. Thank you, and I'm happy to take any questions.
Thank you, Gillian. Councillor Brown.
Thank you. I just wanted to ask one thing, if I might. I mean, part of the issue that lies behind this is stopping reoffending. And I think I'm right to say that in a general sort of way, the reason that short-term sentences were being phased out, if you like, was that there wasn't sufficient time really to do anything useful with prisoners in prison for 3-month, 6-month periods and all that. Now, the 2-year sentence, I note by the sentence illustration, would become a 9-month sentence under the new arrangements as opposed to 12 months. And I wonder if there's any thought about what the implications might be for the effectiveness of that particular prison sentence in preventing reoffending, and if there's things that can be done to kind of boost that, if you like.
Thank you, Councillor Brown, for that question. Yes, I mean, I suppose as part of the release planning arrangements that community justice partners are putting in place is very much about ensuring that before release, as well as on release, there's good support arrangements in place. I think this can be demonstrated with our Alcohol and Drug Partnership Commission services that we have both in Addywell as well as across South Lanarkshire areas. So I think the key to preventing people going back into custody is having the strong engagement both before release and during release and through somebody's journey to try and keep them out of prison. And we can see that support through assertive outreach with our community recovery services that we have. So, you know, mentioning, for example, the Beacons and SACRO. So they will be key in trying to support people, but also our housing colleagues, as explained in the report, have been working very hard to try and look to provide stable accommodation on people's release. Rather than looking at bed and breakfast arrangements. That's going to be critical because what we know from the research is that stable accommodation does help prevent reoffending. There are obviously wider impacts. We recognise that in terms of trying to address reoffending going forward. And obviously the government's put in a range of measures around the release, the Bail and Release from Custody Act in terms of looking to put an onus where people that are attending for court would have been considered for remand, looking to increase the opportunity of bail supervision for people. So there's another, I suppose, example of where we're trying to prevent people going into custody, preventing short-term sentences and trying to keep people from going back into custody.
Thanks, Gillian. Suman?
Thank you. So thank you, Councillor Brown, and other colleagues again for your interest in this over a number of meetings here. It's really important that we recognise this within the context of the wider pressures in the justice system as a whole in relation to this. So there's a range of issues that need to be dealt with. Frankly, a lot of it needs to be addressed at a national level. As we've highlighted, Justice Social Work Services are an important aspect of that. It's important that we've got the resources in place, and we will look to provide you with reassurance that we make best use of the resources that we have at a local level, and how we'll be engaging with our partners in respect of it. It does require good partnership working from all the different constituents involved in here, and we are very thoughtful and very conscious of the particular demands this will be placing on our housing colleagues, not least given the particular pressures that they already face in terms of supporting the communities across South Lanarkshire. Thank you.
Thanks, Suman. Eileen?
Oops, the Daisy, wait a minute. Thanks very much, Chair. I think Suman just touched on something that I had been writing actually and thinking. It is a whole component, and just as there's national pressures and national emergencies within, say, the prison services, but we also have pressures within the council, and indeed we called a housing emergency for South Lanarkshire. So if our colleagues in social work services, if our colleagues in housing are working in tandem to try and see what's, happening, but in between that we've also got people who are out there desperately waiting for houses for various different reasons, so there's somebody else in this mix. But where exactly does the Scottish Government sit within this whole picture? Because have they got somebody or a department or whatever who actively works with each council now in Scotland, as it'll be, to see what's going on and how you can help to alleviate the pressures that undoubtedly will be coming, along just shortly, if they're not already here sometimes. So, as I say, it's a whole component. So there might be an emergency there and overcrowding in the various different things, money-wise, etc. But equally, here, we've got the same, and we've heard it all morning from virtually every department that is anything to do with social care or people in general. So I just wondered, where in the mix really does the Scottish Government sit? Apart from saying, I'll give you £1 million or whatever they're going to give you.
Thanks, Eileen. I think you've highlighted a number of key issues there. And I think the important thing is that Gillian was talking about, an implementation plan, and that, we're monitoring and evaluating, which I know will be ongoing, and that we are alerted as elected members and as the relevant committee to any issues as they come up. And although there has been, some additional funding allocated, I mean, you're right, there's still significant pressures out there, particularly in relation to homelessness, temporary accommodation, housing. I mean, the glib answer is, we need more houses. So it wasn't kind of aided by the housing capital, budget being reduced from the Scottish Government. But to me, I think it's just important we are aware of the issues that come up, and that we do highlight that to the Scottish Government, and they are aware of the pressures that are on local government at the moment. I do think that, notwithstanding all of that, you could be in a position, as Gillian was saying, that outcomes for certain people will actually improve, because it is far better, to particularly maybe if you have a substance misuse issue, it's far better to be kind of supported in the community, near your family, linked into services. In some ways, it's kind of gold standard. If somebody asks you what would work, for certain groups of people, not all, obviously, that's probably precisely the model that you would put forward. So it's a bit of an irony in all of this. We can offer a kind of Rolls-Royce service if we weren't under so many other pressures. So, I mean, I think the key thing is that we are monitoring and reviewing the situation, and that information's coming back to this committee. So I don't know, Gillian, you'll be able to fill in the context better than me if you want to add anything to that.
No, I think you've summed that up really well. I mean, we've just had provided to us the lessons learned report from the emergency early release from last year, which, you know, we'll be able to provide committee members as previously promised. There will be an opportunity after the 3 tranche release at the end of March with the Scottish Prison Service and the Scottish Government to review how this has went. And I think I'd also noted within the report that you know, that we, certainly the government are looking for, you know, an update within the first 2 years of how these arrangements work, because obviously this is a long-term measure going forward.
Great. Thanks, Gillian. Suman?
Thank you, Chair. Just another point to add in off the back of Councillor Logan's point, which is very well made here. So as Gillian's highlighted, we understand the complexities of what we're trying to do here, the importance of working closely with our colleagues within the Scottish Prison Service and indeed with government and other agencies in respect of this. And there are areas that we across Scotland can do better within this space, and we are committed to doing better. That said, there are certain challenges of not just doing this at the scale we haven't been asked to do this, but at the pace. As Gillian said, the lesson learned report is now being shared. A reasonable question would be about maybe that if that had been completed prior to this process starting, that could have maybe informed in more detail what we've been doing here, all being the good efforts that Gillian and other colleagues have taken to ensure that we have reflected at a local level on our previous experience and tried to inform the process we're undertaking on that regard. The other element, though, I would just want to make more broadly, and I again appreciate that members here understand this, is that this is just yet another challenge for justice social work, in this case social work services, across not just South Lanarkshire, but again the country. So we will often have discussions, and we'd had quite a useful and important discussion earlier on around delayed discharge, for example. I just remind committee members that that isn't the only thing that we, our staff, our teams have to deal with. That's not the only area that Liam, as Chief Social Work Officer, has to provide leadership on across our services. We're not here to just do one thing, and so we always appreciate your support in terms of us taking a balanced approach across that and again communicating that message more widely and critically to our colleagues in government. Thank you.
Thanks, Suman. Councillor Allison?
Thanks, Chair. I mean, it is a very good report in many ways, particularly good to see that the staff we have are considered a major strength. But it does highlight the issues we had in 2019 within the Hamilton area. And one of the changes was in the structure, if you like, of the management. Sorry? Oh, sorry.
Sorry, I saw it the wrong way.
Sorry. I'm ahead of myself. Apologies.
Okay, thank you. I don't see any more questions. Okay, just thank Gillian for the report. Do we agree to recommendations too in the report?
Agreed.
Agreed, thank you. Moving on, item 12, Care Inspectorate update for registered care services, 1st of July to 30th November 2024, and that's pages 127 to 152. And could I ask Liam to speak to the report? Thank you.
Thanks very much, Chair. Committee, this is the regular report which we bring every 6 months for an update on the care inspection activity that's taken place over the previous 6 months. The period this is covering is the 1st of July to the 30th of November. In relation to the recommendations, we're asking that it be noted, but also to note the improved position within the Hamilton Care at Home service. I predict there might be a question on that at some point during the deliberations. In relation to the background, it's the standard background about the roles and responsibilities of the Care Inspectorate and the criteria for inspection. Just to note for the committee at 3.4, there's been 2 new quality frameworks that have been issued by the Care Inspectorate that are relevant for ourselves. One's the Quality Improvement Framework for Adult Support and Protection, and we're likely to see that will now be the framework for inspection going forward for ASP. Another one's the Quality Framework for Childcare Agencies and supplying childcare staff, and again that's what will be inspected on. Section 4 gives the inspection outcomes for our internal services, and you'll see at table 1, it's a list of those that were inspected within that period. What you should note is for MacKillop Gardens, they've achieved 5s during their inspection, and that's notable that in 2022 they had the same grade, so they have not improved, but they've not deleted, and that's a very high standard that they have maintained. In relation to the care at home service, we've got the East Kilbride care at home service and the Hamilton care at home service. You'll see East Kilbride have again, they've sustained 5s across the board, and that's what they were in 2022 as well, or previously in terms of their inspection. And that was more a light touch inspection because they're seen as a high performing team, so they've managed to maintain that high performance. Hamilton Care at Home service is the one of note where we've seen significant improvements since 2020 when we had the improvement notice. And again, what we should reflect on that is that there has been, as well as the leadership within that group, it's the same staff predominantly that have been dealing with that within Hamilton Home Care. But there's been a significant change in terms of the leadership for team leaders and the registered managers. And we need to commend their leadership in actually improving this service going forward. And that's been acknowledged by the senior management team within the social work. Home First services as well, you'll see, are actually identified there. These are new teams, the home assessment teams. And this has been their first inspection. And we're very pleased to see that actually for their first inspection, they've actually achieved 5s and 4s. And that's actually a very strong position for a newly registered service. In relation to some of the highlights that are within that, they're identified at Section 4 for the Hamilton Care at Home service and for the East Kilbride Care at Home service. At Section 4.16, you see there's reference to the thematic review of justice services, and Gillian Booth will be giving an update report on that later, so I'll not say too much about that. At Section 5, we've made reference to the inspections of external services as well. The reason we've highlighted this is because we were notified by the Care Inspectorate of 3 services which had weeks, which is actually a red flag for looking at actions to improve that service, both for the provider but for the local authority to be notified. In relation to the Crawford House one, we've got no young people within that service, so it was solely just for noting for us. But for the Trust Community Care Limited, you'll see that we've got 86 South Lanarkshire residents, and we've been working with that provider to make sure that our residents are safe within that. But you'll see that a follow-up inspection is that there have been improvements that have taken place. And for the Divine Care and Support, you'll see that we've only had 1 resident that was within that, but currently as we speak, there are no residents that are within that service. But again, we're happy to note the Care Inspector have looked to see improvements within that service. Appendix 1 gives out updates for all the internal registered services, and Appendix 2 is for the external for noting as well. So I'm happy to take any questions, Chair, for Ian and myself to respond to.
Thanks, Liam. Councillor Donnelly.
To pick up the point that that was made, I think this committee, it would be excellent for this committee to commend the work that's been done in the Hamilton office in regards to the leadership that was given for guidance to the staff, and that they have stepped up to the plate and done excellent work. And being in that field, I know how difficult it is being in the leadership role. So well done to them all, and hopefully that can be taken back. Thanks.
Thanks, Mary. Thanks for acknowledging that. Councillor Allison.
I think I'm now on the right paper. My excuse is I'm at an age now where I'm needing to practice for senility. Also, congratulations to Liam in anticipating a question. Like Mary, it's very good that our staff are seen as a major strength, but one of the changes you have made is to the structure after the 2019 review. And I note that although we are still good in our management, it's indicating that there are areas for improvement. Is that an indication that we've still a lot of work to do with these changes, or is it an indication that we perhaps have not went down the right track?
Suman.
Just for clarity, so that's got very good across the board. So just to highlight then that this has been a product of a range of activity that's been undertaken both within the service and, as you've seen, within 4.12 across the range of the structures. We are not complacent about the quality of services that we ever provide. We are committed to continuous quality improvement. So all of our areas We are always undertaking learning to see feedback we can get both from the inspectors or indeed our service users and indeed our staff members. So it's never a case that the job is done here. But I would reinforce the fact that actually getting very good across the board is extremely rare, particularly given the particular pressures that care home services are currently having to deal with at the moment. And I think that leadership should be wholeheartedly commended, not least within the management team here, and I would particularly single out Ian Beattie for his consistent leadership in this over many years, because this has not happened overnight. Thank you.
Thanks, Simon. You want to come back in, Councillor Allison?
No, we'll leave it at that. But
Okay, could I just kind of echo the comments that have been made in terms of the huge improvement that's been made in relation to Hamilton. I mean, obviously people remember at one point there were significant issues. The improvement made has actually been quite exceptional, and I would just acknowledge that and echo the comments that have been made, and also in terms of the overall report. The work that's been done and the high performance levels that there are under, as Suman has said, very difficult circumstances. And also, we are aware and have highlighted the areas, and as we always will do, in terms of vigilance and improvements that we're in the process of making. But I would certainly put to the committee in terms of the overall performance level, outlined in this report under the circumstances is quite exceptional. So I don't have any more questions. Sorry, Ian. Sorry.
Yeah, I was just going to offer a point of clarification. So I'm wondering if Councillor Allison's picking up on the 4s that were scored against the home assessment team in Hamilton. So just to clarify, that's a brand new service, with a brand new management team. So actually they've returned an exceptional result for a service that's been stood up and has been evolving over the time period. So I think that's what that score reflects. So 4 is still a very good outcome for us. I'd anticipate that should improve going forward, but it's a good result for a brand new service that's been evolving over a period of time.
Okay, thanks, Ian. I don't have any more questions. Thank you for the report. Moving on to item 13, South Lanarkshire Social Work Justice Services Engagement and Care Inspectorate Thematic Review. That's pages 153 to 156, and I ask Gillian to speak to the report. Thank you.
Thank you, Chair and Committee. The purpose of this report is to provide an update on feedback from the Care Inspectorate following a thematic review and validation exercise undertaken with Justice Social Work Services in October last year. Section 3 outlines the Care Inspectorate thematic review activity in respect of the Scottish Government priorities outlined within the National Strategy for Community Justice, specifically in respect of Aim 2, which is to ensure that robust and high-quality community interventions and public protection arrangements are consistently available across Scotland. Building on their previous scrutiny activity, the Care Inspectorate have developed a self-evaluation approach which enables Justice Social Work Services to consider the extent to which their service can confidently and robustly evidence the performance, quality and associated outcomes of the support and supervision they provide people on community sentences. Section 3.3 advises that South Lanarkshire Council Social Work Justice Services engaged with the Care Inspectorate to test a new self-evaluation template based upon Quality Indicator 6.4, which is Performance Management and Quality Assurance. Alongside completing and submitting the template, Justice Services participated as a pilot area for validation with the Care Inspectorate visiting on-site in October 2024. And this was to meet relevant leaders, members of Justice Social Work staff and people who use our services to explore the supporting evidence and triangulate key findings of the self-evaluation. Highlights in section 4 note the feedback we received and the appreciation extended to us offering our voluntary engagement on this new approach. The Care Inspectorate have stated that South Lanarkshire Justice Services' approach to self-valuation is robust, considered and mature. They assess the service to be able to appropriately demonstrate strengths and identify areas where improvement is required. They express their confidence in the service being committed and well placed to further develop our culture of continuous improvement and the provision of support and supervision to people on community sentences. Section 4.3 strengths identified include that there was visible leadership at all levels, with leaders demonstrating an open, inclusive and participatory approach with staff. And the vision for the service be communicated well and understood throughout teams, and development and innovation being encouraged and supported at both strategic and operational levels. It was evidence that governance arrangements were clear and comprehensive, and we had a robust data dashboard with clear systems in place to support effective evidence gathering and reporting and analysis of performance data. They also evidenced that performance data improvements were being well driven at all levels of the service, and particularly with individual teams through the service redesign. And finally, that there was a strong culture of learning and commitment to continuous improvement throughout all levels of the service. Section 4.4 states the range of improvement activities we will be taking forward throughout this year and going forward that include developing a robust quality assurance framework and reporting on outcomes that make a difference in people's lives, the people that we serve and the communities. The feedback above is being used to further inform and enhance operational developments for the years ahead, and the outputs which will be reflected in future reports to the Committee on Justice Services Performance and Development. I conclude this report by asking Committee to approve the following recommendations and that the contents of this report be noted. I'm happy to answer any questions anyone might have. Thank you.
Thanks, Jill. Just before I go into that, could we go back just for a second to item 12, Care Inspector Update? Did we agree the recommendations in that, or could we agree the recommendations in that report? Thank you. Okay. Thanks for that, Gillian. I don't have any comments. Could I just say this is an extremely positive report, and I think it was really excellent that South Lanarkshire had the opportunity to participate in that, and kind of all the learning that you invariably gain from a process like that. But in terms of the feedback, I mean, it's exceptionally positive. And looking at the up-and-coming improvement activities, I think that will be really interesting. And it would be really good to get you an opportunity to attend some of that. And I think there's some really useful suggestions around quality assurance, well, building on what criminal justice already does, but it would be good to explore that further. So thank you very much for that report. It's extremely positive, which is a good thing these days. Are we agreed to recommendation 2 in the report?
Agreed.
Thank you. Next item is, sorry, I'm getting mixed up now, same as Alec, is 14, notification of contracts awarded April to September 2024, and that's pages 157 to 162, and could ask Suman to speak to the report. Thank you.
Thank you, Chair. Thank you, members. So, routine report the members will be familiar with, providing notification in line with standing orders on contracts awarded by the resource during the period 1st of April to 30 September. As set out within 3.1, it's a requirement of the standing orders and contracts that details of all tenders accepted above £50,000 be reported retrospectively. Here, other than those where the award is not the lowest under tender or the cost exceeded the initial financial provision, I would direct you to the details provided within the appendix then about the contracts awarded for the period 1st of April to 30 September. Noting that these have all been done on the basis of the lowest offer or the most economically advantageous to the authority and the people we serve. And I would then take you back to the recommendations under 2.1 for approval. Thank you.
Thank you, Suman. Councillor Hosey.
Thank you. It is hose, but
Oh, sorry.
Thank you. I just want to kind of maybe also jump back to the previous paper as well, where awarding of contracts for care home services. What are the contractual obligations of these services to the people they're caring for? And is there any financial implications for their poor performance? Apart from as the council going in to help them improve their service, they're getting handsomely paid for.
So I'll come in. So thank you for that. So obviously all providers of social care operate within the regulatory framework set out by the Care Inspectorate. So they have to meet the standards set out by the inspectorate body and account to them through the inspection process that's undertaken. We provide support into those processes, but it is primarily one that is led by the Care Inspectorate. That's the national approach in respect of that. You are absolutely right, though, to kind of highlight the resource implications that are put on social work resource, in our case, the Health and Social Care Partnership, when a particular provider, be it care at home or any other, find themselves in dire straits and requires support. In the past, this might have been something that was more exceptional, but certainly across the country, it's been happening more frequently. We don't get additional resource in terms of doing that, and certainly there's not a billing, for example, arrangement that's in place with external providers. I have to say myself and a number of other senior officers have raised this nationally around whether we need to move to some other type of arrangement. That's part of an ongoing conversation, but certainly as if elected members also wanted to raise that to your own mechanisms, I would be very encouraging of that.
So, supplemental? So, obviously, we're not privy to the exact details of what's in these contracts. Are there financial penalties in these contracts for poor performance? Are you privy to that? That's the case?
Ian?
So there's not a direct financial penalty, but in examples that were given, where we were giving business to these organisations, where we would generally place a moratorium on any new care packages being offered. So there is a direct impact in terms of their business, and indeed if some of these moratoriums were to last for any length of time, there can be a fundamental threat to the viability of the business. So it's clearly in the organisation's interest to respond promptly and effectively to the issues raised by the Care Inspectorate, so they can get their standards back up to where they need to be, and we can then recommence the contract with them.
Again, sorry, supplemental. So all these companies are probably very well aware that if they underperform, they know that South Lanarkshire is going to step in and help them improve. That isn't any incentive for any company who hold a massive contract to self-improve. So they're just relying on us. They're bouncing off of us when they don't perform, because they know we're going to step in. And it's costing the South Lanarkshire Council money for them to improve. There's nothing for them to actively improve, self-improve, because they know they're getting their money, apart from a moratorium, which I'm glad that is the case. If they don't improve, they're not getting any other contracts. But it seems to me that there's no incentive for them to conduct themselves properly. And maybe that's a national issue, but...
Simon or Ian?
I'm done now, by the way.
Yeah. So, I mean, the incentive is primarily driven by the Care Inspectorate, the regulatory body. So if an inspection grades it up to 2, and we'll have, improvement actions expected of them by the Care Inspector, they have to deliver on those, because ultimately if they don't deliver on those, the Care Inspector can remove the registration, so essentially that they're not allowed to then deliver care. So that's the primary incentive. If they don't get better, the business will cease to function. As Simon's indicated, there is a cost to us, because we do have to provide support, but that's often quite directive support in terms of, we're concerned about this, these are the actions you need to take, and there's quite a lot of monitoring and direction to those providers to, I suppose, insist that they take action to bring themselves back up to a reasonable standard. Otherwise, we can't continue with the contract.
Okay, thanks, Ian. Councillor Donnelly.
Thanks, Chair. Would it be right, Ian, that these companies, if it's support at home, they've got social workers, they've got review meetings that they can take place, and they've got a care package where you would have outcomes so that they're meeting the life that they wish to have. so the organisation would be always being checked. There would always be a check in their work practice and to make sure that the delivery that's been asked for is actually taking place. Because I think we've also got to take into consideration that they're giving support over a length of time to someone, and that person has become very familiar with that care package and with the people that are supporting them in order to live the life they choose. Thanks, Ian.
Do you want to come back on that, Ian?
Yeah, I'll just come back quickly. So the provider is obliged to put in place a person-centred, individualised support plan to make sure that the person's cared for effectively, and that's clearly one of the elements that the care inspector will be considering. So is the quality of the care plan there appropriate? Are the carers properly trained and able to deliver on the content of that support plan? So in essence, where grades are coming down, the care inspector will have concern about some of those processes, the effectiveness of the care that being delivered, and the capacity of the provider to make improvements. So that's the fundamental concern that's been illustrated where we get to that level. So clearly the care inspector is required to have an improvement plan, you know, to kind of, and that may mean immediate actions, as in you need to do better on this tomorrow, or you may have 3 months or 6 months to make improvements. And we will also be involved in the monitoring of those improvement actions to be satisfied that the provider is actually taking the appropriate steps.
Okay, thanks for that. No more questions. Agree to recommendation 2 in the report?
Agreed.
Agreed, thank you. Next item, I have no items of urgent business. So with that, could I close the meeting and thank everyone for their attendance and thank the officers for the reports and for your contributions. Thank you. Have a nice day. Thank you.
Thanks.